Hi, I'm Doug Thompson from the Wellness Dentistry Network, and we have quite a few members now globally and regionally. And people ask me, we have the ability to order some medical biomarkers through Cleveland Heart Lab, and they often ask me, why do I need it and what is this? So that's what I want to share with you today. And we have several WDN members with us, and we'll do a little Q&A at the end. The Cleveland Heart Lab panel is, as soon as I can get this going here. The Cleveland Heart Lab panel is a pretty interesting piece of information that we as dentists can partake in. Early in our career, we were really concerned about tooth loss from periodontal disease, and now we have a newfound concern, and that's inflammation and the effect on all systemic health. The whole world started to learn about it in 2004 in this Time magazine publication. And then more recently, there's been great works like the inflammation syndrome, which I recommend that all practitioners have in their operatories to help patients understand what's happening. And interestingly, it's the bugs that live around the teeth that cause the issues for us. So physicians that are interested in heart attack and stroke prevention, and here's quite a few good books from docs that have that interest, these physicians understand that the relationship between the oral pathogens and heart attack and stroke risk is really, the relationship is really exemplified in the biology of the blood vessel. And that's really what these bacteria do. And they cause vascular inflammation, which then affects the biology of the blood vessel. And so if I can share just a couple pieces of information and literature about periodontal disease, we would see that periodontal disease is significant, especially in men under 50. This particular study says if you're a man under 50 and you have periodontal disease, there's a 72% increased risk that you have or could have a cardiovascular or vascular disease issue. So I started to look differently at my younger patients with periodontal disease, and I started to think, I wonder how much inflammation some of these bacteria are causing. And we used microbial metrics to help us figure that out. This basically, this test, and I'll use my mouse to show this test right here. This is one of the lab tests that we would use to look at the pathogen load in a patient with periodontal disease. We also know that if patients have a heart attack or a stroke, in the atheroma or in the clot, we find oral pathogens. So we're looking at this particular study that looked at endarterectomies. We see that 78% of the time we have Porphyromonas gingivalis, 61% of the time Telnorrhea fracynthia, 74% of the time other bacteria and Fusobacterium nucleatum. The idea is that we have a situation called the traveling oral microbiome. And the oral microbiome, whether it's Alzheimer's disease, periodontal disease, colorectal cancer, they cause a lot of inflammation. However, in the past, we've had to rely on physicians to help us determine if there's a medical biomarker of inflammation affected by these pathogens. And so now we can do that ourselves. So if I look at this cutaway of a blood vessel, this is from Cleveland Heart Lab. If I look at this cutaway from a blood vessel, we start to see various stages of the disease. And I'm going to first circle this one area, and this is a healthy blood vessel. And in this healthy blood vessel, we have a normal muscular thickness layer. We have a normal endothelium, which is the protective barrier in this blood vessel. However, when we feed our body the building blocks of atheroma, we start to develop fat in the wall of the vessel. And this fat and inflammation accumulates in the wall of the vessel, and the vessel actually expands outward before it expands inward. And what happens is the fat is held in the vessel wall by a cap, a fibrous cap that sits on top of that. And what many studies show is that it's inflammation that actually causes enzymes to breach this fat cap or to breach this fibrous cap, and stuff spills out into the bloodstream. And this is a genesis of a lot of these sudden heart attacks and strokes. As a matter of fact, 50% of men and 64% of women that die of a sudden heart attack or stroke have no prior symptoms. They don't have chest pain, shortness of breath, dizzy spells, just no prior symptoms. So we know many of the population that's sitting in front of us has cardiovascular disease. However, they don't know they have it. because we don't have the tests or the metrics to determine if they have it. Well, we do. We do have the tests. We have something called a carotid intima media thickness test. However, it's not accepted by widestream medicine and done by and performed in physicians' offices routinely. It's something that insurance doesn't cover, but it's something that's very available. The other beauty of this story is along the way, there's biomarkers that are given off that suggest either you're at risk for this disease or it could be a measure of disease activity. And so these are the biomarkers that are underlined in black, and these are the biomarkers that are actually listed right here. And the significance of this particular frame, the slide that I'm showing you, is that we have clear evidence that periodontal disease affects the elasticity of the vessels, the way the endothelium functions, the way HDL functions, and even the atheroma process itself. And what we have are these measurable biomarkers that we can use to help determine what's happening. Like HSCRP, for instance, that's an old one that people have used for years and years. And HSCRP is basically just a measure of whole body inflammation. You could have an illness and your HSCRP could elevate, but that's very unlike something like LPPLA2. LPPLA2 is an enzyme that's actually given off when there's atheromatous activity. So LPPL2 is a disease activity indicator, not a disease risk predictor, unlike some of the other ones. Myeloperoxidase is the same thing. So wouldn't it be neat if dentists could have some kind of glimpse at the vascular health of their patients, and what would that mean for them? Well, good news, Cleveland Heart Lab has this inflammation panel, and this inflammation panel measures these exact biomarkers. And Cleveland Heart Lab, which now has a relationship with Quest Diagnostic Laboratories, wants to be the leading heart biomarker company, basically of the future. And I think they can and will be that. So that's the idea. We have this inflammatory panel that Cleveland Heart Lab has authored. If you look at the book that's written by Dr. Bale and Dr. Doneen called Beat the Heart Attack Gene, and you attend one of their preceptorship courses, they make you highly aware of 25 to 30 red flags of disease. And interestingly, if you look at the red flags of disease, many of these we can see in our dental patient population, even while they're sitting in our chair. Things like smoking, things like periodontal disease, things like stress and depression, psoriasis, elevated uric acid, gout, obstructive sleep apnea, which many of our group have strong diagnostic skills in sleep and breathing disordered sleep. Hypertension, insulin resistance, diabetes. 80% of all diabetics die from a heart attack or a stroke. So I want to show you what happens in my practice if I have people sitting in front of me that have these disease red flags. I start to think, I wonder how much internal inflammation they have in their system. And it would really be cool if we started to keep medical metrics on our sleep patients. And as we improve their sleep health, we could run a correlative study. Do we improve their medical inflammatory biomarkers? My hypothesis is we will. So Joan comes in. This is a typical patient in my practice. Hasn't seen a physician in quite a few years. She has several red flags of disease: increased adipose tissue, hypertension, reflux disease. She has periodontal disease. She was actually referred to me by a periodontist because they thought she had a yeast infection. I actually measure yeast in my practice, but not a high bacterial load. I further am more concerned about Joan because she says she measures her diabetes through her diet, and she hasn't seen her physician regularly. So I'm very concerned, and I'm wondering, I wonder how much vascular inflammation she has. So I send Joan to a physician, and I can show you, and you know from looking at the chart that the red, yellow, and green has significant meaning, and red is not great. But looking at the chart or the breakdown of her Boston Heart Lab report, they broke the report into lipids, inflammation, metabolics, and genetics. And I would share with you that if you just took that number one, lipids, right here, and you replace this with bacteria, this is the exact same pathway that periodontal disease takes in our patient population. And so what do we learn about Joan? We learned that Joan has a severe dyslipidemia. These are the lipid numbers for her. And the Boston Heart personalizes the report for Joan. More importantly, we look at her inflammation. This is her inflammatory panel, and her myeloperoxidase is very elevated, which causes severe disease instability. Her LP-PLA2 is also very elevated, which is a disease activity indicator. We know Joan's in trouble. And the heart lab also goes on to tell her if your inflammation is not addressed, you have a significant near-term risk, 1 to 6 months of a heart attack or a stroke. How did Joan learn this information? She learned this information because I simply looked at the red flags of disease, cardiovascular disease. I knew she had periodontal disease, and I suggested to her, please go see a physician to get an evaluation. So we also need physicians to help, and this is why we need collaboration in our networks of professions. So what do we have in the Wellness Dentistry Network? Some of our tools we want our patients to know these top 25 things to stay alive. We want our teams to know, identify these top 25 things to help keep your patients alive. We want our patients to know why they need a complete, thorough, comprehensive gum and bone evaluation. We also want to be able to look at visual cues. We want to look at people with excess belly fat. We want to look at people with caries or periodontal disease. We want to look for people that have diagonal earlobe creases, Fordyce granules, different things that can, visual cues that can tip us off. Hey, you know what? This patient probably has a much higher incidence or risk for cardiovascular disease. And what if I could measure something that would tell me that? How beneficial would that be for me? And that's really the genesis of the WDN Cleveland Heart Lab panel. That's how that started. So what we did is a year and a half ago, we called Cleveland and we said, I have a group of dentists that I think would be very proactive if they had the ability to order some labs as a screening tool. That's specifically what I wanted it to be for, a screening tool. So Cleveland Heart Lab put together for us a very nice screening panel, and we took the large Cleveland Heart Lab requisition sheet and we picked off some tests that we thought would be good screening tests for dentists. In other words, I'm not going to treat these diseases. I only want to identify these diseases, and then I want to work with people like Dr. Ford Brewer and other doctors that are networking with WDN to give them the ability to work with these patients and help them be healthier. That's really the idea. So here's what happened. The Wellness Dentistry Network lab panel evolved. And when that panel evolved, if you look at this, if we look at this lab panel right here, I can get into it a little more specifically, but it has on it myeloperoxidase, LP-PLA2, HSCRP, and I'm going to show you this in a case here in just a minute, another case. And what information did I want from this lab panel? I wanted some inflammatory biomarkers. I wanted a general biomarker of lipids so that we could, as dental group, determine if somebody has a dyslipidemia. But I don't want to know the details of the dyslipidemia because I'm not going to treat it. I want Dr. Brewer and other doctors to treat that. I also wanted some brief information about metabolics. You know, if we have patients sitting in our chair with uncontrolled diabetes or pre-diabetic or even borderline diabetics, they're going to heal differently. And then what about a couple pieces of key nutrient information, omegas and vitamin D? This is crucial. So Cleveland was kind enough to negotiate with us and put together our own confidential fee schedule that in our network, in our library, is available to all of our WDN members to take advantage of. And again, the cost for this lab panel over here for us is $135. That's your cost. I pass this on to the patient, and I don't upcharge it at all. I just pass this on to the patient, and then we can give them this data that they can use for their medical care. Additionally, I had an attorney draft a screening, basically disclaimer, and this says we're dentists, we're not physicians, nor are we trying to be physicians. We just want to find out who in our chair has a lot of inflammation and who in our chair needs more help from another allied professional other than just us. That's the idea. So here's a case. This is typically now how I would use this. So I hope I've really outlined why I generated this test. And now here's a case, an actual case of mine that we employed this technology on. And what are we thinking about wellness? We're thinking there's an optimum approach to wellness. We need to know something about metabolics. We need to know something about lipids. We need to know something about inflammation. We need to know something about vitamins. We love to have some genetic information as well. And obviously hormones are part of this. It's not part of the WDN lab panel. So Charlie comes in. You can see from these slides that Charlie has a significant issue. And Charlie needs some disease management. His particular disease problem was caries. We also have studies that show that 78% of the time, if you have strep mutans are also going to be found in the atheroma. Additionally, you can see on the he has a lot of need for restorative dentistry. But here's my big concern about Charlie. He hasn't seen a physician in 8 to 10 years, and he doesn't really know about his vascular disease status. But I see other clinical signs. I also see periodontal disease. I see periapical disease, as you can see on the Panorex. So I'm very concerned about Charlie, and I would love to know. I wonder how inflamed he is. Charlie also has active periodontal disease, as represented by the perio chart. And so now I would like to ask Charlie if he would do the lab test. He says he would do the lab test. And you can see by the WDN panel, which cost me $135, you can see all the green. You can see all the green. You see one red biomarker, basically one red biomarker, and there's another red biomarker in omegas, and there's a yellow biomarker in oxidative LDL and his lipids, and another marker. But again, what this tells me is that Charlie is in all the major inflammatory biomarker. Charlie is pretty clear to have for me to do surgery. And here's my concern. My concern is, you know that when we do surgery on patients, we create a transient bacteremia. You know, when we do cleanings on patients, we create a transient bacteremia. That's clear, or we wouldn't pre-medicate patients that have artificial hearts and artificial limbs. So what we found out in Charlie is his pre-surgical treatment numbers were all in the dangerous inflammatory pieces were all green. He did have one elevated biomarker, but this particular biomarker doesn't put him at severe risk for immediate acute heart attack or stroke. All the rest were pretty green, so I went ahead and we started to do work on Charlie. What we also did is we did the surgery on Charlie, and we wanted to measure 1 month post-treatment and 3 months post-treatment so that we could see what the trend is in these biomarker numbers. And this is what I'm hoping that my WDN members will do, is take somebody diseased, grab some pre-metric data and some post-metric data. And if you have high levels, if these numbers were red, I would not work on Charlie. I would call Forward, or I would call Tara, or I would call somebody in our network, and I would get help for them because they would need that before they needed our work. So these particular biomarkers are inflammatory in nature. We have this, which is part of our lipids investigation, which is just an ApoB, ApoA1 ratio. We have some metabolic numbers, and then we have some key nutrient numbers. And this is great information for us to learn as a screening tool in the management of Charlie's disease. And so I bring this piece to you. What's the current concern? The current concern is we know that people go through a transient increase in systemic inflammation with dental treatment. So I would like to know what their inflammation level is. We also know that without periodontal treatment, this continues to go on. So I'm not suggesting we don't do the treatment. I'm suggesting that we have a panel that allows us to see who has a lot of inflammation before we do the treatment, and then what is the effect of our work. Does our work actually have a discernible difference over a longer period of time? So I think it's important to assess and treat all patients that have cardiovascular risk before you enter an aggressive periodontal treatment program. It would be great. And what I would say even more is that I would love to have more people evaluated before we start any kind of treatment. And it's really nice for your patients to know that. MSNBC put a thing out on TV in 2010 about how heart attack and stroke risk can be elevated after dental work. So this is not new information for us, and I think it's really nice that we have an opportunity to look at patients' inflammation before we do our invasive dental treatment. And in fact, if you're wondering if your office is not the right place for this, maybe you say, I don't think, I think this is practicing medicine without a license. I don't think it is. This is actually an advertisement from our Chicago Midwinter Dental Meeting about one of the labs that was there, explaining that only a 35 to 40-minute health screening for $150 could give you a battery of tests that normally cost $200 or $2,000 from a physician. And what does it do? It's a screening test, and it's a test to give you an idea of who is at risk. I think it's incumbent on all of our WDN member dentists to please be aware that you have the tools in your toolbox to determine somebody's risk of disease, and more importantly, you have resources in the library of where they can get treatment and management of these diseases, so none of your patients have to be a victim. That's really the idea. So I think, when I look at these tests that are offered through this screening profile, it's HSCRP, it's advanced lipids, it's carotid artery ultrasound, it's body mass, blood pressure. It's some of the same basic information that we can get in our practices on our patients with just a little bit of skill. So that's the idea. And what's happening to me now, I get referrals in from physicians for take care of patients that have elevated HSCRP, take care of patients that have elevated myeloperoxidase. This is what they're saying on the phone. Inflammatory illness consultation. What's causing health problems? I need a perio evaluation from asked for by a cardiologist. So this is how the collaborative relationships are changing. And as you put yourself out as a Wellness Dentistry Network member dentist in the community, more people are going to call on you to do this kind of work. So Tracy, I know that you're managing the meeting. I'm going to stop my screen share now, and I'd like to open it up to any questions that we might have in dialogue.
The first question is, where do you get the blood drawn?
Yeah, the blood needs to be drawn by a laboratory that is certified to draw blood. If you have a phlebotomist or a nurse practitioner in your office, which some people do, they can be trained to draw the blood. Quest Labs will be able to draw the blood, Quest Laboratories, but they need to be trained by Cleveland. So right now we have on our network, we have an instructional sheet in the heart disease module on who to call, how to set up that contact, and that person will contact the lab by you, and then they can go ahead and do the blood work for you. So I am not suggesting that this blood work be done in your office or by you, because it needs to be handled properly.
So once you get the report, who do we send to read it to help explain the report to us?
Yeah, we could do another webinar on the significance of the meaning of the biomarkers. But Dr. Brewer could do that for us. Dr. Dahl could do that for us. We have in our Partners in Health section of the network, we have several physicians that we can reach out to help us do that. And I think everybody should take a Bale-Donine preceptorship course, which is a course designed for training physicians. But it's a perfect, they're usually attended half by dentists, half by physicians. And this is a great place to learn, Tracy. We spent 2 days talking about inflammation, risk factors, biomarkers. And so this education can happen there. But I also want to bring that, we also want to bring that to light through WDN. I also have put in WDN a tutorial on each of the biomarkers. Cleveland Heart Lab has a beautiful educational resource. You can call and talk to their consultants on the phone. And what I would say, Tracy, is I know it seems foreign, but it will only take a couple tests before you start to see patterns develop, and you'll know when you should act and when you shouldn't act. And it's not really that difficult. I've just gotten tremendously comfortable with it. So I appreciate the question, and I don't want to make light of it, but we've spent a lot of time learning about it, and we'll go over it too at our member rally. We can start doing a small teach pieces on each of these biomarkers. And Ford, you're on the phone, I know. Ford, you're on with us. What would you say, and what are your comments about what we should do and how we should handle this information?
So thanks, Doug. Yes, I do have a fairly strong feeling about it. It gets to the point you brought up about, is this the role for a dentist? When I was at Hopkins, I ended up doing a lot of public health screening programs. And one of the most important things you can do in terms of motivating someone to take care of their problem is show them the actual objective information. Many of you may have been walking through the lobby of a YMCA and seen them doing blood pressure screening or even cholesterol screening. The people interpreting those cholesterol tests are usually physical trainers. So compare this to a physical trainer doing a cholesterol test. The physical trainer at the Y knows very little about cholesterol. They haven't had the training that you guys have had. You guys know a lot more about this panel, whether you may think so or not, than they know about that. This is a critical problem. It's, you put this together with heart attack, stroke, and dementia, the things that it causes. These are the #1 killers and the #1 disablers in our country.
Yeah, and Ford, you're fine. Correct if our WDN members have a question, a quick question, look at a report. I don't want to commit you to more than you can handle, but I do know you're very open for developing relationships with our patients that are in trouble. You've done that for some of mine. Do you have anything, are you comfortable
Sure.
helping us with that?
Sure, a couple of things. #1, it's at prevmedheartrisk.com.
Yeah, Ford, I want to remind all of our WDN members that are listening, in our Partners in Health section that can only be seen by WDN membership, you're listed in there, all your contact information's in there. I can't tell you what a nice resource Ford's been. Several of our members are starting to work with Dahl and work with others as well. This is a network. This isn't about one person. It's about a group of people really trying to help each other. So Ford, you couldn't be more generous by throwing your cell phone out there and allowing us to have utilize your skill as a resource. So I thank you for that. That's what our membership's about. We need to share with each other. So I really appreciate that.
Thank you.
Tracy, is there anything else that we can open this up to anybody? Any questions is fine.
So Doug, let's say Monday morning, what would prompt me, or how should I talk to a patient about, I feel like you have a lot of signs and symptoms that are high risk. How should I present it to them to go get some blood work done, and I can send it to Cleveland Heart Clinic?
Yeah, I think one of the things you would do, Tracy, is if you see somebody that has really high risk for cardiovascular disease and it's obvious to you, or they just even haven't had good medical care in for years, it would just be great to say, as an oral care provider, and I know you're really big in airway management right now, looking at airways, but if you see somebody with sleep apnea, AFib, you can probably assume that there's some downstream biomarker elevated or particular, or altered because of those diseases. And you could just simply suggest out of care and concern, do you know if you have vascular disease? Do you know how inflamed your body is? We are learning that inflammation is a much more serious, having excess inflammation is much more serious and risky for the body than just having high cholesterol. And we have a screening panel that would help us determine where you are. And that screening panel could be very revealing. And this screening panel is very inexpensive. It's it's basically a cash pay price. They pay you for it. You set up your WDN account, you're billed for it. What a nice service if you find out that they have, like Joan, you find out that they're highly inflamed or they have significant issues. You could be the person that discovers and starts to change the trajectory of their lives. And so that's really what I would do. And I wouldn't claim that you're an expert or that you know a lot about it. I would just say, look, I'm working with a group of people that we're starting to take a more proactive approach at screening our patient population, and you have other diseases that are related. And I think it would be a good idea for you to at least explore this option. That's how I would do it.
There's another question that goes, what is the relationship between hypothyroidism and CVD?
Okay, Ford, you're up.
Can you hear me?
Yeah.
Yes.
So hypothyroidism, like insulin resistance, is one of the things that we see increased significantly in two areas. One with just aging, but number two with inflammatory conditions. I don't know if any of you have read any of the books about Hashimoto's protocol, but that's been criticized for a while. As you start to get deeper into the science, it becomes really clear that there's a lot to it. A lot of the things like glutens, gliadins, things in the diet that are inflammatory, especially for a large genetic group of our population, as in like over half of us, sometimes 2/3, have reactions, antibody reactions, and other immune reactions to glutens. Those don't happen just in our gut. We're used to hearing about that with celiac disease. We're used to hearing about it with ulcerative colitis, but it also causes problems with other organs. We could get into the science, and I think we'll probably maybe do that at a later date. But it's very, very common, and it's a very common cause of the problems that we're dealing with.
Now, Tracy, you can imagine the sophistication, or you can imagine, how much there is to talk about. This is really the idea behind our Wellness Week at the Coy Center. I'm proud to say that next week, or April 1st through the 6th at the Coy Center, we're going to have Ford Brewer. We're going to have a respiratory physiologist, a nutritionist, David Mines, and Roger Price is going to be there with us. And we're going to, this is a whole week of lab testing on ourselves and lab testing and showing dentists how we can integrate these tests into the practice. That's really what that is. And I can tell you the other thing, each of you, please run the lab panel, the WDN lab panel on yourself. Run it on a family member first so that you can at least take care of yourself and your family member. You'll get very comfortable with it, and then get some consult from me, from Ford, from somebody else. It's a great way to start.
That's a good tip. It's
a great way to start. Do it on yourself. And so one of the subtitle of our Coy's Wellness Week is, your journey to a wellness practice starts with you. We really have to take care of ourselves. And Ford actually has been a big part in some of the health changes I've made in my own life.
Another question is, can I get insurance reimbursement if this test is ordered by my physician?
Ford, you can do that if your physician can order the test. Is that correct?
For most of these, sometimes you get some pushback on some of the inflammation panel, some of the other tests as well, the F2-isoprostane. Go ahead.
Yeah, we also have issues, Tracy, with some labs that try to balance bill patients. For $135, this is a bargain. And if you needed to order other tests on the Cleveland Heart Lab panel, you could order those tests, and there's contract prices through that book. So if you wanted to add a couple biomarkers or add a couple things to the test, you could do that. But I'm going to suggest right now that people pay for it. We are not, as dental providers. This would be another area for future growth and development. But if you're already billing a lot of medical, I would have to have that question be answered by somebody who has expertise in that area. It's not me. And I would do it maybe through through Cleveland Heart Lab's billing department. Or Quest. That's what I would do.
Doug, if I could, I would add that we've had our own problems. All medical practices have problems with this, and a lot of it goes back to the balanced billing issue that you just referred to. If we're able to negotiate, as physicians, we're able to negotiate up front with the labs for a cash pay, but not for the insurance. It's whatever the insurance company has negotiated. Patients are tempted to say, well, go ahead, see what insurance will pay, and then I'll pay the rest. Unfortunately, many labs, like the ones that you've referred to, will come back and say, okay, now we've got the doc out of the way, we've got the insurance out of the way, this patient has gotten labs from us, we can charge them 10 times what we would normally have charged either the doc or the insurance company. So it's far better to just go ahead, list it up front, even for the patient, for cash pay, than it is to pay post-insurance in most cases.
Yeah, Tracy, I want to add one more thing too, and I share this very openly when I'm trying to help groups understand the kind of care they need today. I'm sorry that it's too bad that great care is for people that can afford it, but I don't think it's unreasonable for us to expect to pay somewhere between $3,500 and $5,000 a year to have good medical care. Unfortunately, if you try to use just insurance and be healthy, our insurance world right now is really providing sick care. we're not providing preventative health care, you have to buy that. And so all of us need to, we have to come to grips with some of these things we just have to pay for. And for our care providers, I beg them to find out about their own health, because we care for several thousand people, each one of us, and we have to be healthy to do that. And unfortunately, right now, we have to pay for it. That's just how I feel about it.
That was a great presentation. I like got so much in that like short bit. I was like, oh, good.
Okay, was everybody, now I want to make sure that if we make this available to the world, everybody for the last 10 minutes has been on screen. I need to make sure, Tracy, we need to make sure that's okay. This has been recorded. I can post it.
One more question. There was a question is, so the Cleveland lab will draw blood and do the entire panel for 35? I thought the blood is drawn separately than the panel. Is that all together?
No, what happens, Tracy, is there's the Wellness Dentistry Network lab panel is that specific grouping of tests.
Okay.
It gives you a little bit about inflammation, metabolics, lipids, and some key nutrients. That particular lab panel that's on the requisition form in the library cost you $135, and you'd want to pass that cost on to your patient. If you ran that whole battery of Cleveland, if you checked every box on the requisition sheet, I don't know what that would cost. It would be a lot. But you can order other tests. If Ford, let's say Ford wanted to really do a comprehensive evaluation on you without genetics, I think I added up the cost of the panel based on WDN pricing, and it's about $600. So you can get a beautiful, anywhere between $135 and $600. You can get so much nice information that you can find out who in your patient population has issues that they need to take care of. And Tracy, if we just focused on cardiovascular disease, early Alzheimer's and dementia, and diabetes,
Yeah.
it would be huge. We could do that very, very easily.
So does it vary? Does it vary where they get the cost, where they get the blood drawn at? That's one of the questions. Like if they went to Quest Diagnostics to get the blood drawn versus their primary care, so that's like an added cost, right?
Yeah. Quite often it is, especially if there's yet a third party. Quest has recently merged with CHL, so sometimes does not charge for the draw fee. But if they don't go to a Quest site, sometimes some of the Quest sites are still charging. And I've never seen them charge over $10 to $15.
Okay.
Okay. And Tracy, I use a mobile service. I use a mobile service in my community. And in the mobile service world, it's anywhere from $45, I think, actually $25 to $150. You could have a mobile phlebotomist. I actually get these blood panels done on myself. I do it every 4 months, like a perio chart. I have a phlebotomist come to my office. She charges me $130. She draws my blood, processes it on site, takes care of it, and it's super easy. And so, and there's mobile services. This is part of what the labs will help us find, or where there's mobile services. And as we work with Quest, we'll be able to go into Quest offices. But please, at this point, we're in April 2018, I'm asking no WDN members to send a patient blindly to a Quest laboratory right now and ask for this panel. That wouldn't be appropriate. I'm asking you to follow the appropriate channels, to go through the rep that's listed in our library, Todd, and let Todd handle this for you. He'll set you up and he'll guide you and tell you what to do. Steve, I believe he's done that for you. Is that correct?
Yeah. Can everybody hear me now on this?
Yes.
Mm-hmm.
All right. So actually, I can tell you my experience. We had this done both ways. We had it done for myself through a prescription that Ford wrote for me because he's been managing me. And then we had our patients through Todd Hill set it up through WDN panel. And it was initially the workflow wasn't smooth, but now our local Quest lab is set up for it. And they did it seamlessly when we finally got it all set up. They did the draw seamlessly through the panel that Ford had us do, and they also did it for our patients seamlessly through the WDN panel. So that's really taken a big part of the monkey wrench out of it, and it's been a huge plus for us. But if you're going to use WDN panel, you have to speak to Todd Hill first, and he will contact that particular lab directly and do a full training with them. Those panels, no matter who does the Cleveland Heart Lab panels, they can only be drawn Monday through Thursday. because some of the spins have to go to a different processing lab. The one in our area happens to be in Teaneck, New Jersey, but they have to be done within 1 day, so they have to get it out there. They have to be drawn on Monday through Thursday, but it took a little bit of time. But with Doug's amazing help and the contact with Todd Hill, it's been really fantastic, and it's made a big difference for us.
And Tracy, the bottom line here is we're really trying to encourage our members to thoughtfully order labs and start to identify diseases for patients. So we'll always have somebody to connect with at the company to help us get set up and to do this appropriately. We don't want to create confusion for people, but we have several members now that are starting to use this service. And so that was the function of this, was to make you aware of why, to make you aware of how. It's in your library. I'm happy to spend more time guiding people and coaching people. My team can help as well. That's part of what we like to do, is help people get set up. And once you get established, you'll be off and running. And now you'll have medical metrics. You can tie some medical metrics to your dental metrics. And that's how we can start to really let the world know we can make a big difference.
That's awesome.
Okay, so with that, Ford, I thank you. I thank the guests that have taken the time to come on. Jeff, I see you're here, and I see Steve, couple Steves, Nancy and Iris. I appreciate you being on. Rena's on by phone. And Tracy.
Doug was on from his plane. Did you see that?
Who's on?
I thought Doug, Ed Borio was on his plane.
Oh, is he?
I have a picture of him on his plane.
Oh, he might.
No, I'm on the computer. I've watched the whole thing.
Oh, have you, Rena? Okay,
Yeah,
good.
yeah.
Tracy's at the helm, so I have a very limited view.
Yeah, no, and I'm not on video. That's
Okay.
the difference.
That's looking at some of these people on video, Rena. That might be smart.
It's a bad angle.
You guys all look great. You look marvelous. I'll see you all soon. Thank you so much for attending.
Thank you, Doug.
Thank you so much, Doug.
All right. See you soon.
All right. All right, we can I'm gonna slowly end. I'm gonna end it. Did you stop the recording yet,
Yep,
Doug?
I'm going to stop the recording right now. Good night. Thank
Thank
you.
Bye.